Good evening, sir.
Hi, good evening. How are you?
I am good, sir. Thank you. How are you, sir?
I'm good, yeah, always good. So, are you going to talk about CPR?
No need. No. As you told, I'm not going. So I removed it. I've removed it.
Yeah. Say and say that if you want that CPR, we say that we will have a special webinar on CPR where you tell them about schematic representation. Have a CPR represented schematically, frame by frame, as a cartoon wise, explain to them how it should be done. We'll do it at some time, right? You are in your room.
Yes, sir, in the room.
Okay. Your name is Dr. Indranil Das, no?
Yes, sir.
So speak slowly and explain to them, right? And
Sure,
then there'll be take 20-25 minutes. Then there'll be question answer, which I'll ask questions, and that's it. Should not be difficult at all. But take your time, explain everything how it happens. All right?
Sure, sir.
We will once we have I'll give you a cue. Then you can open your video and audio at that time. Right? Okay.
Okay, sir.
Okay.
Good evening, everyone.
Very good. So, IT, are you going to stream online on Facebook or
sir?
What are we doing?
Sir, 2 minutes, please.
No, that's okay. But are we going to stream on Facebook? How are you going to do it?
Sir, ready hai, just start karenge.
And will you post it on YouTube also?
YouTube, sir, YouTube में भी कर देंगे. YouTube में भी कर देंगे.
में भी कर देंगे क्या होता है भाई? प्लीज करिए, करके लिंक दीजिएगा. ठीक है?
अभिषेक सर ने सिर्फ फेसबुक के लिए बोला था तो ठीक है मैं कर देता हूँ सर.
अभिषेक सर को मैं बोल चुका हूँ YouTube में डालेंगे because that's more easily convenient.
Okay.
वरना फेसबुक के लिए हर आदमी को फेसबुक अकाउंट रखना पड़ता है. तमाम फेसबुक अकाउंट नहीं, मैं देखता ही नहीं. मैंने फेसबुक पिछले 5 साल से देखी. मैं क्या करूं?
मैं फेसबुक में भी फेसबुक यूट्यूब दोनों ही स्ट्रीम कर देता हूँ.
हाँ, करके हर हफ्ते करिएगा और हमें लिंक दीजिएगा.
Okay, sir. Okay.
ठीक है. So now it is 5:33. Let's start at 5:35. Give me a cue. Okay.
Okay, sir.
I'm waiting.
Okay, sir.
IT, are we ready?
I'm ready, sir.
No, IT, I'm asking IT. IT confirm please.
सर फेसबुक में हो गया है, यूट्यूब में कर रहा हूँ सर.
करके confirm it to me.
हाँ, ये सर. सर हम लोग
Okay, IT, I'm starting.
सर
Thank you.
फेसबुक, हाँ फेसबुक में लाइव हो गया सर. ओके सर.
It's okay. It's okay. Thank you very much.
वेलकम
Thank
सर.
you. Namaskar. This is Dr. Alok Roy. Like every week, we are starting Health is the Ultimate Wealth, a series of webinar every Saturday, 5:30 to 6:30, we meet. The intent is to make you aware of various things which can go wrong with your health and how do you take care of it so you stay healthy. We call it pre-hospital well-being. You don't want to come to the hospital, preferably if you are at home and safe. That's good for us. We have enough disease burden in this country. We want our friends, our acquaintances, and all those who seek our help stay healthy. Whenever we think of accidents, we always think of something which happens on the road, in a traffic, or which happens in outside world. Honestly speaking, we see so many accidents happening at home. Very silly accidents. Like, I always laugh when many of you come to me and say, look, I'm building a house. I want to get a Vastu consultant to advise me about the how to keep the house, how to make the house, what to keep where. I would go a step forward and tell you that if you really want to live well, get a consultant who can tell you how to prevent accidents at home, what all to provide at home so you are safe. How many of you have your bed corner rounded up or smoothened up? Many times from the corner of the bed, your knee or your shin gets hurt, gets scratched. So many times you have a chair which is unstable. You topple on that. There are toddlers who are crawling on the floor and put their fingers in the switch, in the plug points and get electrocuted. So many things go wrong. How many of you have a non-skid mat in your bathroom? The commonest place where accidents happen. How well lit your house is if you have elderly living in the house. Because when they walk down to the bathroom in the night, they wake up in the dark. And because there's no switch nearby, they have to go and switch on near the bathroom, and that's how they trip and fall. So many accidents we see every day. So when we are running this series of various health tips, we thought that we will cover accidents at home. And who could be the better person? I have with me Dr. Indranil Das. He is the head of our accident and emergency department. And we get almost 50, 60 patients a day in our ER every day. And many of them are just a victim of home accidents or home casualties. You'll be surprised. Almost every day or every alternate day, we have one person who's brought dead to the hospital. By the time he comes to the hospital, he's brought dead. We declare him brought dead. What happened? What went wrong? What can be done to prevent it? I have with me Dr. Indranil Das. Over to you, Dr. Indranil. Please explain slowly and in a language which my friends can understand. Thank you, Indranil. All over to you.
Thank you very much. Namaskar. I will start with a small presentation and slowly I will go through the different types of common emergencies that we face in our day-to-day life, and if advises how to tackle them and how to go ahead and keep ourselves safe. I'll be sharing my slides and hope everything will be fine. Is my screen visible to everyone? I hope everyone can
Yes,
see.
very clear.
Okay. So, very important is to be prepared. It says that to be prepared. We need to be prepared to know about the common things that we might face, and if at all we face them, how to deal with it. So it is said that timely first aid is very helpful before you seek any medical assistance or even a medical help arrives. While our immediate response to an injury might be panic, and we do that, it's a common human nature. We do panic, but having said that, keeping calm will help us more rather than panicking in a situation when you face emergencies. So when you keep calm, we'll be able to give a first aid, help the victim, our near and dear ones, and give them the best support. So I will go through a list of common aids and household injuries. But very much important is that if the situation is very grave, always do remember to call for medical help afterwards, because it is your doctor or the medical personnel who can help you give the better advice. But at home, we with our family members, our friends, in the office with our colleagues, in the school with our fellow people, in the colleges with our classmates, there are different places where we are surrounded by people, and some small emergencies can happen, which by keeping calm we can deal with it very properly. So the first one are the burns and the scalds. Very common. Burns commonly seen in our kitchen, where our mothers, our sisters, or even we, when we go to the kitchen to do some work, there is chance that we can get burned. This is a common place. Apart from that, our children can get burned from different things that lie astray in our home. As rightly pointed out by Dr. Alok Roy sir, that there are small things which goes unnoticed, but these in the long run may give some serious complications. So there are different types of burns that we encounter. From a medical perspective, what I can say that the first degree burn, or the commonness that you see when you get burned, you get a blister in your hand, and or sometimes it's very painful. It's called a first degree burn. The first degree burns are the most painful because right below our skin, the protective layer, there are nerve endings. And when you get burned, it gives us tremendous pain. So a first degree burn will be quite painful, and it can create a situation of panic. But again, don't panic, keep calm and give the first aid. So the burns can be caused through dry heat, such as fire, a hot metal, or contact with an object charged with high tension electric current. Or it can be due to friction with a revolving or fast moving wheel or any rope. There can be additional burn injuries due to chemicals. Well, we may not be having some chemicals at home, but sometimes there can be simple things like acids, alkalis, and these are corrosive chemicals which when comes in contact with the skin causes burn injury. I've told about burns, and there is another point called scald. Now, what is a scald? A scald which is caused by an injury by a moist heat, like a boiling water, a steam, hot oil, or coal tar. Now, out of these, boiling water, absolutely in everybody's house, we do have steam and hot oil. We are using nowadays those geyser, which are instant, makes the water hot very rapidly. Good to have such appliances, but it comes with an additional instruction that whenever these are run, we should be careful while starting using those. So what happens in a burn? Commonly, the color of the skin changes. It becomes red. Sometimes difficult to differentiate when the complexion of the skin is on a not a lighter tone. It becomes very difficult, but it burns, it's painful, and there is formation of blister, or this occurs due to destruction of the skin or of the deeper tissues. The areas of most burns and scalds, including the clothing, are sterile for a certain period because it has burned, and the local area, even if it is covered with a cloth, which also gets burned and gets stuck to the skin for initial few duration, the area is sterile. And efforts should be made from our end in our home to keep them so until a medical help is being sought. So the area is sterile. We don't want to infect the area more, because whenever there is burn, the skin is burned and we lose the natural protection. So the layer of the skin lying below becomes exposed to infection. So initial phase, it is sterile, but it can become infected. So until you seek medical help, no need to make any efforts to do anything. But in case of major burns, move the patient definitely to a hospital as quickly as possible. Because it is so painful that the patient may need some medication, pain medications, and even anesthetics to be given to help the patient relieve the pain and do the dressing of the burn. So if it's a major burn, try to avoid giving patient something to eat, because he goes to the hospital, and if the doctor wants to give some anesthetic medication, it will be difficult if he or she has drank something or eaten something immediately after that. So try to avoid that. So what happens? It's burn, fine. But if there is a fire, in the home, definitely in modern houses, so in modern houses, there are fire alarms, there is a fire reservation, there are security procedures to prevent fire-related injuries in high-rise skyscrapers and the newly constructed buildings, offices, schools, and colleges. But at all, if it happens, the system can fail. So what should be done? You should stop the process of burning, drop down, and roll. Now, what happens if you do that thing? Now, to stop the process of burning, I'll tell there are different ways to stop the process of burning. The most important thing is to drop down, because if it's a fire inside a closed room, whenever there is a fire, there are fumes that are produced, which are toxic to us. So if we drop down, we may avoid those toxic fumes getting inhaled in our lungs, because it is said that hot air is lighter, it goes up, and the cold air takes its place, and it gets warm and it goes up. So always crawl out of the room if there is a fire inside. Roll out of the room and to save. Now, there can be victims who are affected, and you and we all can be a part of that incident. Now, we should be safe ourselves in order to save our colleagues, our near and dear ones. Keeping a fire extinguisher at home Portable small fire extinguisher nowadays available is also comes handy, but it's not only keeping, you need to know how to use it. So go through the user manual, and the people at home should also know how to use it. One person knows, if that person is not there present, so it will be difficult even you have a fire extinguisher. Next, fire can be due to some electrical malfunctioning, some circuit problem, some sparks. So switch off the power supply if it is safe. Always switch off that. Remove any constricting jewelries. Now, if it's a fire injury caused by fire to any part of the body, we all have we all wear some jewelries, maybe a bangle, some rings, some watches, some bands. We might be wearing, and when we get injuries to the arm or to a definite part of our body, including the digits, if we have a ring in the finger, we should try to remove it before, because whenever there is burn, there is swelling. So if the swelling lands up, it will be very difficult to remove those jewelries. So before things worsens, remove them. It will also be helpful. By the time you reach the hospital, the swelling may become quite prominent, and then it will be difficult, painful for the patient, of course, but it will be difficult even for the physicians to remove it. So clean the area with plenty of clean water and submerge the burnt area in cold water. So it stops the burning process. Now, very important, what not to do in burns. Whenever there is a burn injury, do not apply cotton wool over the burnt area. Do not apply any greasy substance. Toothpaste, hair oil, moisturizing ointments. These are many things we'll see in the hospital, people applying and bringing the patient to the emergency. But that should not be done. Cold water, clean water, stop the burning process. Do not attempt to remove any stuck clothing. Sometimes nylon clothing, which we wear, get stuck with the skin when it is burned. If we try to peel it off, what it will do, it will peel off the skin along with it. So don't do it at home. Do not put ice on the burns. Only simple, plain, cold water. It's not chilled or ice. If there is a blister which forms on the burn, do not break it, because it acts as a natural protection to the skin. It keeps the area more sterile. Once you break it, it opens up and there's a chance of infection. Do not touch someone who is still in contact with an electric source. Very important. Burns due to electricity, malfunctioning, we have our reflexes comes up to help the person. Definitely we do that. But if the person is in contact with an electrical wire or some electrical contact, we should not touch, because we get electrocuted and we become again a patient, again a victim. So we need to have a safe approach, a safe environment to help us, keep us safe, and to help our fellow person. So treatment of burns: halt the burning process, relieve the swelling, relieve the pain, minimize the risk of any additional infection, and definitely, if you think that it is required, and I would advise that if required, seek a medical advice. Smaller burns, minor burns can be managed at home, but we need to be very careful. But if you think that it is not manageable, do seek a medical advice. Now, as I was telling, for acids, thoroughly flood the part with water. Bathe the part freely with an alkaline solution, which can be made from 2 teaspoons of baking soda or washing soda in 1 pint of lukewarm water, if it is available. If it's not available, absolutely okay. Normal water, flood the area, make the area clean so the acids goes off, washes off. Do not rub. Again, for alkalis, if the burn is caused by alkalis, brush off any remains if it is. Clean with normal saline if possible. Now, normal saline, by that we mean water mixed with a normal salt. That makes the water normal saline. You can clean it. Bathe the part freely with a weak acid solution such as vinegar, lime juice, dilute it with an equal quantity of water. Now, you may not have those things such as vinegar or lemon juice easily available. So clean with normal saline or with a weak acid solution if possible. Going on to my next topic, very commonly, heart attack or chest pain, commonly say heart attack, heart attack. Now, uh, it's a big spectrum. We see a plenty of patients coming with chest pain. There are multiple different causes of chest pain. But a heart attack or a condition where the chest pain is due to cardiac problem, it needs a fast aid and quick response. So the most important thing, anyone getting a chest pain or chest discomfort, make him sit comfortable, reassure, tell him or her that there is a help nearby. You are there to help him. We all carry mobiles, and it's very easy for us to call the nearest emergency helpline number. But we need to make the patient reassure and keep him calm. The more exertion, the more the patient becomes tense, his chest pain or the complication related to it may increase. So what happens in heart attack? It occurs when there is a loss of blood supply to the heart. Our heart gets blood supply. It is made of muscles. So the muscles needs blood supply. Whenever there is loss of blood supply to the muscle starts crying of pain and the patient gets the chest pain and then lands up with a heart attack. This happens when these arteries or the blood vessels which supply the heart gets blocked by some blood clots. This is the most easiest description of what exactly happens in a heart attack. The symptoms, pain and discomfort in the chest area. There can be breathing problem. Even patient can have upper stomach problem, tummy problem. There can be sweating while sitting in a air-conditioned room also. Suddenly, the patient can have sweating associated with pain. The pain can radiate to the jaws, to the neck, to the shoulders, to the arms. Point to remember, women are more likely to have breathing problem, abdominal pain, dizziness, and tiredness in a cardiac condition. I have highlighted that golden period of treatment, the time of onset of a patient with chest pain, and if at all it is a cardiac problem, is the first 90 minutes. We have a span of within the 90 minutes. If the patient reaches the hospital and the patient is being diagnosed by the specialist and taken up for the definitive treatment, the best outcome, the best survival is being seen. So call the nearest hospital or any emergency helpline if you suspect that these symptoms are present and the patient is complaining of this. Then do definitely call the emergency helpline. What to do? As I told you, call your local emergency number. If you can't get an ambulance, then you can drive your neighbor or your friend or your family to the nearest hospital as soon as possible. Now, there can be situation when you might be alone and you know that there can be chest pain due to a cardiac problem. You know the symptoms and you are alone. If possible, call for help. It's always safe to call for help. Now I'm telling about the rarest situation. You have called or there is no one to help you and you are able to mobilize, then definitely call the nearest hospital. Let them come to fetch you up. If still that is not possible, drive yourself to the hospital. Now, there is a very important thing, driving yourself if you have no other option, because your condition may worsen while you are driving. It will put yourself in an additional risk and others on the road also at risk. If possible, chew or swallow an aspirin tablet, which is a very simple medication that may be available and should be kept in every household. Don't take aspirin if you are allergic to it or you've been told by your doctor never to take aspirin for any other reason. Nitroglycerin, not always available, not easily available, but this is another medication that will give for the initial period some relief of the chest discomfort. But that doesn't mean that you took a nitroglycerin and you are relieved and you are okay, fine, will be on with my other activities. No, If you had a chest pain, you took nitroglycerin or you have given nitroglycerin to someone and the chest pain is relieved, then definitely you next thing reach the hospital, get yourself checked, examined by a specialist. Cuts, as it was told earlier, that minor cuts and there can be major cuts. So for a cut, be sure to apply clean dressing after administering the first aid. Now there can be cuts most commonly while our family members, our mothers, our sisters, even we while working with sharp things at home, we can get cut. Common response. First, to stop the bleeding. The most important way, the easiest way is to put pressure. Clean the area if it is dirty with normal water. Then put pressure over the area and try to apply a good clean dressing. If it is a smaller cut, with pressure, with a small clean dressing, the problem will be solved. But if it continues to bleed, then what? You need to keep on continuing the pressure over the area and reach and seek the medical advice. Major cuts and wounds can be incised wounds, which is fine incised wound, like sharp knife. Lacerated wound, it may not have a sharp or fine linear edges. It can be lacerated. There can be contusion. Something falls on heavy falls, it causes contusion, damage to the skin and the subcutaneous or the underlying structure, and it bleeds and it cuts. Puncture wounds, again another important. These wounds on appearance looks very small. So the entry point may be small, but the depth of the wound may be quite deep and it can involve the deeper structure. Best example, bullet injury. Small entry wound, but inside there can be major damage. Similarly, whenever you see puncture wounds, which is on the natural tendency, it's a small wound. But if it's a puncture wound, there can be deeper, it can be have a long depth. So to prevent that, we should be very cautious while we deal with different types of wounds. In case of wounds, follow the steps below. Place the patient in a suitable position, elevate the bleeding part. Now, whenever a part is bleeding, if we keep it elevated above the level of the heart, the flow of the bleeding decreases. It may not stop, but it may decrease. Immobilize the part which is affected, do not move. We need to keep it immobilized. Do not disturb any blood clots. Whenever there is blood, clot forms. Now, don't make an attempt to remove those clots, because once the clot is removed, it can start to rebleed again. Keep the clot. That's the natural process of stopping the bleeding. Remove as little clothing as possible to expose the wound. Now, someone can get wound through the clothing, and we don't know what is happening below. So we should remove as little as possible without disturbing that area which is wounded. Apply and maintain direct pressure over the wound and clean dressing or bandage if it is available. It's summertime now, and we are going to see the rise in temperature. People who are working outdoors on a job which involves going outdoor can land up with heat stroke. When the scorching heat of the sun causes dehydration of the body, our inner core body temperature rises, and it causes a condition which is quite serious, heat stroke. Now, initially, the first aid procedure during heat stroke requires to cool down the heating process. The heating process has to be cooled down. So that is the most important first aid. What should be done? Immediately move the patient out of the heat. Remove excess clothing if he or she is wearing. Cool them using whatever means possible. Placing the person in a tub of cool water or a cool shower, very good. It's a very good way to cool down the external body temperature. Spray with a garden hose. Sponge with cold water. Fan while misting the cold water. We can spray water and fan while doing that. It causes evaporation and takes away the excess heat that is there on this body. Place ice packs, cool towels on the neck on the armpits and on the groins. This will dissipate the heat and will cool down the temperature. Cover with damp sheets, and if possible, make the person drink plenty of fluids and electrolytes. Heat stroke, if it at all happens, signs and symptoms include fever. You can feel the temperature while we check the fever. Similarly, when you touch the patient, it will be hot, and we put the thermometer more than or equal to 104 degrees. When the temperature rises, our temperature control center in the brain causes some changes in our mental behavior. The person can become confused, he or she can become agitated, and can have some difficulty in speech. The skin may be hot on to touch, dry skin. There may be sweating, but this sweating is a natural phenomenon to cool down the body, but it may not help. The person can start vomiting. The skin, if it's a fair complexion, you can see flushing of the skin. The pulse can become rapid. The heart starts beating faster. Person starts breathing rapidly. He or she can complain of headache. And even in older patients, there can be fainting, dizzy spell, and person can faint. So these all symptoms don't happen, but some of them can happen, or a combination of some of those can happen in such condition. Next comes fractures. We all have heard about fractures. We get tripped, we get falls. It can be smaller fracture, minor injuries, or it can be major fractures. For a fracture, the most important, immobilize the part affected. This is the first aid. So first aid is to immobilize. Whenever a bone is broken, the more we move the area, the more the pain happens. Also, the fractured bones move, and it can, if it is in alignment, it can move and can get displaced. So whenever there is a fracture, if you think that there is a fracture, immobilize the area, give support, and don't move the area. Simple fracture is when there is no wound. It's no wound from outside, but you can see some deformity. You can see at the site of the fracture, there is severe pain, tenderness. When you hold the area, the patient cries out in pain. Any fracture, any pressure over the area gives too much of pain. There will be swelling. Whenever there is injury, there is swelling. So there will be swelling. The area which is fractured can get deformity because the bones are not in line, have become malaligned, and it can be deformity. And irregularity of the continuity can be felt. General rules, what we also say to our patients coming to the emergency: use RICE, R-I-C-E. It's rest, apply ice, compression, and elevate the area. Very basic, very simple thing you can do at home until you seek the medical help. If possible, fix the hand in a position with collar and cuff sling. You can see in the picture, is a towel which is folded, and the hand has been put and it is tied on the neck. So let the weight of the affected limb be taken by the neck, and the part get immobilized, the part is raised, the part gets less movement, so less pain. Secure the limb firmly to the chest by bandages. The first with its upper border level with the top of the shoulders, and the second on the other side, and you can tie it on the back of the neck. Always is better, if possible, I'm not telling that you should do, but if possible, ask the patient to keep, if whether the patient can move the finger, if it's a fracture to the arm or the forearm. Or if possible, look into the pulse, the commonest place that we know, the radial pulse on the wrist, if how the pulses are. So these are very basic things that you can do, but definitely this is not the treatment. You've given the first aid, and now it's time to bring the patient to seek a medical help. Electrocution, live wires. Nowadays, concealed wiring are there in our buildings. Lucky, but there are places where you can have live wires or open wiring, and these with time gets eroded and gets exposed, and exposes us and our family members to this. So an electric shock requires immediate first aid. Prompt action, perform the following steps. Switch off the main source, and if it cannot be put off, cut off the supply by removing the plug. Breaking the cable or wrenching it free. Never attempt to cut a cable with a knife or a scissor. No. Remove the patient who is in contact with the current using greatest care by using dry insulated materials. For example, I can say wooden piece of wood, piece of rubber, by which you can remove that contact from the patient. Reassure the patient, lay them down on their back with the head low or turn to one side unless there is an injury to the head, abdomen, or chest, and loosen the clothing around the neck, chest, and waist. If possible, wrap them or cover them. If the person affected is stable, talking to you, give them some sips of water, but never give any aerated drinks, plain water. When to contact your doctor? A person who has been injured by contact with electricity should be seen by a doctor, because we don't know what is the voltage or the amount of current that has passed through the patient. Because what happens when you touch a live wire, the current passes through an entry point and it traverses all the way, and it's a natural tendency for the current to follow the area of least resistance until it goes out through an exit. So along the path, our major organs, the most important is the heart. And with the current, high voltage current passes through it, the heart becomes abnormal, starts functioning, starts behaving abnormally. We get abnormal heartbeats. So caution, don't touch the person if he or she is still in contact with the current. Call your emergency number or even the electricity department. If you are in a multi-story apartment, call the maintenance, inform people, and definitely seek for help. Overhead power lines aren't usually insulated. So if there are overhead power lines, we should keep ourselves away. This is a part of prevention, at least about 6 meters away. Don't move a person with an electrical injury unless he or she is in immediate danger. Now, if a person gets electrocuted, falls down, we should not be moving that person suddenly just like that, because we don't know, apart from electrical shock, he or she might have got some other injuries. So we should be very careful, lying the person flat on the ground, and then even seeing how well he is or she is, and then taking medical help, seeking help from people, and slowly moving that person out. But again, I'm reminding you, all who are going to help others should be safe when dealing with such kind of situation. Bites and stings, everybody might have had. Commonly, bee sting, very painful, and it causes a lot of discomfort. We also see a lot of patients coming to our emergency, bee sting, and they get a lot of allergic reaction to that. So there can be other bites, dog bites, cat bites. There are pet dogs, there are pet cats. Even there are stray dogs, street dogs, which can also bite. So whenever there are animal bites, we should wash the wound with water to remove the bacteria-filled saliva that the animal is carrying in its mouth. And when it bites, those gets into your body. Keep the bitten part low. Bathe the wound with a solution of potassium permanganate if possible. It's not a mandatory, if possible, or only plain clean water, and take a proper wound care. Insect bites like stings, if it's a bee, wasp, etc., remove the sting with a pair of tweezer or small forceps. We can remove, because if the bee sting remains engraved in the skin, it will continue to cause irritation and more pain for the person affected. By the time you seek medical help or reach a hospital or a doctor, if possible, with a tweezer, if it's visible, to remove it. You can apply pressure around the area and it may try to remove it. Wash thoroughly with soap water and antihistamine lotion to relieve the itching. The most common is electrocalamine lotion, which is a time-tested lotion available in every pharmacy, everywhere. It gives a soothing effect to that area. but avoid too much of scratching, because if the sting is still impregnated, you will make it may cause more injury to the affected area. Next comes choking. This can happen. It's a common thing that we were told in our when we're small by our kids, by our parents or our grandparents, do not talk while eating. Very important. People tend to do in meetings with friends. We eat and we're talking at the same time. There is chance of getting choked. And when we choke, it can turn out to be a life-threatening condition. Normal reflex, something goes to the throat, we get a cough reflex. We cough and we spit it out. Safe. But if it's a bigger piece of food chunk gets stuck in the throat, it will block the tube through which air goes into our lungs, and we land up in a very difficult situation. So the picture says about the ways how to relieve choking or to help the person who is choking. The first picture says about the universal sign of choking. If someone is choking, then this is a common natural reflex. He or she may not be able to talk because something is stuck in the throat. This is a common tendency of holding. This is called the universal sign of choking. And when someone is like this and is unable to express himself or herself, and you know that this can be a choking, it's an immediate quick action. We need to relieve that person from the choking, because from a partial obstruction to the windpipe, it can land up into a complete obstruction, which will be very difficult and can be life-threatening. So in that case, we do the maneuver called the Helmich maneuver, where we stand behind the patient, we bring both our arms in front, and in the second picture you can see how a fist is made and a hand over there, and we give a big thrust on the abdomen. The thrust should be so much so as to generate such force so that the obstruction is relieved. The person spits it out. Simple maneuver saves a lot of complication. We can give 5 back blows. Both the Helmich maneuver and sometimes back blows can also help. So do not do blind finger swipe. Someone you see that has come is choking. Do not open the mouth and try to put your finger to take that out. This is a blind finger swipe, is not at all advisable. If you see something very obvious, if you take it out, okay. But if you don't see anything, and the person is holding like this, you should not be doing blind finger swipe. Then we may convert a partial obstruction into a complete obstruction. For infants, if the infant is choking, we do this maneuver by taking the infant on our lap and giving back thrust or back blows. Seizures, fits, different names it's been given. If someone is seizing, lay the person on the ground, make the person lie down and make comfortable as a first aid measure. It is epilepsy due, and it is the easiest term if I say that there is some electrical malfunctioning on the brain, and causes different jerky movements, frothing from the mouth, uprolling of the eyes. And if you see something like this happening, try to make the person lie on one side, preferably on the left lateral, and let the seizure pass through. Definitely call for medical help. Commonest mistake, patient, there is movement of the jaw. Never put finger inside the mouth of a person who is seizing. The force of contraction is so much that your finger may be bitten off. Clear the area around so that the person does not get injured. Call for help, seek medical help, be with the person, let the person lie on the lateral position. Another common, eye trauma. Whenever it's windy, it's away outside, things get stuck to the eyes. Normal reflex. We take our hand, start rubbing. Please, please, please never do this. We don't know what has gone inside the eye. and more rubbing will cause injury to the eye, and the covering protective layers will cause more burning. So prevent the patient from rubbing the eye and set them facing the light, standing in front of them. Pull down the lower eyelid and try to see if you can locate anything. And if it is there, you can remove it with the corner of a clean handkerchief. Preferably, you can twirl it and moisten it and try to remove it from the lower eyelid if it is visible. If it is embedded in the eye, do not attempt to remove it by giving force, but instruct the patient to close the eye, apply some cotton coverage. Please seek medical help. If there is no foreign body found, or you suspect that something is stuck below the upper eyelid, very difficult to see below it. Lower eyelid, we can pull it down, but upper eyelid, sometimes very difficult. So in that case, clean the eye with normal flowing water. What happens if we run a tap, the water is flowing, and if we blink the eyes in under the water, what will happen? This blinking process and the movement can drain out the foreign body from the eye. It's a first aid measure. I'm not telling it will help, but it helps in most of the time. Do not rub the eye, please, please, please. If some liquid irritant goes into the eye, instruct the patient to blink the eye under water, flush the eye with copious amount of normal water, drinking water. Apply soft cotton pad and keep in a position with a shade and bending. Because whenever there is something goes to the eye, we get irritated by the strong light. Ask the eye, close the eye, cover the eye, but no, it's a natural tendency of us, of human. Whenever something goes, we try to go reflect. This is the most important thing you need to advise to your near and dear ones when you encounter some. It is important to repeat that one should remain calm during injuries and emergency. It will help you to provide better first aid until professional help arrives. So I will summarize these as 3 P's of first aid. Emergencies may happen, can happen anytime, anywhere. We pray it should not happen to anyone. But if it at all happens, we should be prepared to give some first aid. So what is our aim? I summarize it in 3 P's. We want to preserve the life, that is, we prevent any further injury, and we help promote recovery. By giving first aid, we can achieve all these 3 things. We are here to help always everyone who needs, but we pray that you should be healthy and safe wherever you are. Thank you very much.
Thank you, Dr. Das. I think you did a great job of explaining some of the emergencies which can happen at home. Now, I have a question for you. Tell me that what happens when the elderly, they fall in the bathroom and break their hip bone? Then how do you deal with them?
Yeah. So, very rightly said, our elderly population gets tripped and falls in the bathroom. Now, in such case, 2 things can happen. One, we should be very careful while moving the patient or helping. There has been a situation when people try to drag them out, but try to be careful to move the patient as a whole. If possible, seek help, move the patient with at least 2 or 3 persons supporting the hip, the neck, and the head, and then move the person to a comfortable place. By this, we'll be able to prevent any injury to the neck, and also any bony injury that might have happened, and will give less pain and less discomfort to the patient. Neck injury, very important. Broken leg bones can be repaired, can be treated. Neck injury goes unnoticed, or movement of the neck unknowingly will land that person or elderly patient into a lifelong paralysis below neck, and we have seen that happening. So be sure for protecting the neck while moving a person who has fallen down.
So you are saying that
and immediately
support the patient and lift them horizontal position,
as a whole,
preventing their neck and their hip supported, and bring them out and put them in a flat, hard surface. Right.
Yes.
Okay, okay. And then seek help. So you all would agree that Dr. Das has explained some of the home emergency. We can never cover 100%, but whatever, some few things which can happen at home has been covered, and very simple explanations he has given. Seeking medical advice is important. Also keeping something at home, like clean bandages, some antiseptic gauges, some antiseptic ointment at home, may be an important addition to your collections at home. And also that if you have children and if you have elderly, the adult during the course of the day, they are alert, they are careful, they are walking around, they know their houses. But children and the seniors, they are most prone to accidents at home. And accidents happen on the bed, they fall from the bed. If the house is very cluttered, they hit and fall. If the house is not well lit, they hit something and fall. If you are using defective equipment, suppose you want to take out something from a higher shelf and you have a stool which has a very narrow base, or you don't have proper steps to climb on, it topples and you falls. Most common incidents of poisoning happens when you keep wrong things in a wrong bottle at home. When you store a poisonous thing under the common name, people mistake it for a salt and a sugar or something else, and they drink acid. I've heard that, I've seen it. That acid was stored in Coke bottle and people just took it. So a lot of such things can be avoided by better planning. So instead of Vastu expert, get an expert who can guide you about how to keep home safe. Every time you have a spill and you have a children or elderly, wipe it. Don't polish floor to a mirror image, it's not worth it. Have it a little rough or anti-skid. Always use non-slip mat, always. Sometimes the quality of mat is very light or just slips, you put a foot on it, after bathing you come out, step on it, and it just slips and flies off and the man flies off with it. So those are have a well lit staircase. Staircase must be well lit. The bathroom must have a mat. If you have elderly, must have a mat. And if the elderly is showering on a stool, make sure a stool is very sturdy. And there should be the flow of water should in the bathroom must be clearly toward the drainage point. There must not be any water collection in the on the floor. And as a responsible person, every time you use the bathroom and if it is wet, wipe it with a wiper. So the bathroom is ready for the next person. Because what happens when you are bathing it and you have a shower and use soap, then the soap kind of puts a layer of slime on the floor. Next person who comes, he just slips on that. So such small precautions can keep you healthy. I'm extremely thankful to Bengal Chamber of Commerce and Industries and Rotary Club of Kolkata, Vienna for being our partners and taking our messages to you. Stay healthy, stay well. Last week you missed us, we missed you because of Holi. Holi happened on 19th and on the same weekend, we thought that give you a break. I hope you played a safe Holi and look forward to interacting with you in future. Do join us next week again. We'll have something interesting for you. Thank you very much. Thank you, Dr. Das. Have a nice day. Thank you. Namaskar.